Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my hope for you is that with each passing episode, you get closer to being your own best expert. And today we have Julie Streeter, nurse practitioner, here to talk to us about intravenous nutrition. Now, I know Julie really well. She has been on the podcast before. We talked about BioT, which is bioidentical hormone pelleting, and that is a super fascinating podcast. So please listen to it if you haven't. And Julie has been my health practitioner for years. But honestly, this is a topic I know nothing about. So I'm excited to learn and learn at the same time you guys learn. So, hi, Julie.
Hi there. How are you? I just
I'm
want to thank
good.
you, Nancy, for allowing me to come on. I appreciate it. I know you are one person that definitely looks out for the health of others, and you really do reach out to your patients and just make sure that they're getting the best care and you utilize your resources. And I think that that's amazing. So thank you for having me on. Um,
Here,
just
thank
to
you.
yeah, let me know when you want to get started. Yeah, I'm
Yeah.
excited about this topic.
So, this seems like it's something new. I just started, probably your office was the first time that I saw something like that. Now I see like these kind of like boutique things
Right.
showing up around the neighborhood. So,
True.
yeah, give us some history. Just tell us what you know.
Okay, so actually, you're absolutely right. There are a lot of IV drip type of bars and different things, that are out there now, facilities that are freestanding. I'm going to kind of give you the difference between us, at our office and those type of facilities because there is a little bit of a difference. So those facilities set out and actually that is their business. That is what they solely do. They will give IV nutrition through IVs and or IM injections to help with patients who are having issues with, nutrition, the ability to go ahead and absorb all their nutrients and things like this. And it's almost kind of related to something new that patients and people are looking into to kind of help improve their health, basically, right? IV therapy was designed, for more immediate or emergent use, for medications, for, in the hospital setting. But more and more, what you're finding out is these are being more readily utilized, as the mainstream for patients who want to go ahead and get healthy quicker. They're realizing that, perhaps there's so many reasons why you get IV therapy when it comes to nutrients is because we're just not able to absorb our nutrients the way we used to. And Nancy, I know you know that we've been doing, had our practice for many years. I have the ability to go ahead and work with my husband, who is a DO, an area physician and surgeon in Northwest Indiana for many, many years. And so we've actually had this practice together for many years where we've seen the decline, in patients' health. And I know you have as well. We've seen more and more issues with autoimmune illness and dysbiosis, problems with the bowel and issues with, leaky gut, which then leads to a lot of these autoimmune type of illnesses. You name it, there's so many things out there. And I think that this is one of the reasons why people are seeking like functional type of doctors, people like yourself, people who are actually, the truth of the matter is you do have to go outside of your original box of medicine or chiropractics to go ahead and keep up with what is happening today,
That is so
because it is
true.
so different. It is so different, and people are just sicker.
People are sicker and sicker
Hmm.
and sicker. I agree.
Hmm.
It
Yep.
takes multiple avenues of healing. It
Exactly.
take times
So true.
multiple practitioners,
So
and
true.
it's like in stealth health. It's how to unravel your mystery because I talk about in here how you need your resources,
Right.
which is why we're doing this podcast.
That's right. That's
So,
right. It's so important.
mm,
So people are, we're finding, and we look at so much blood work and labs, on every patient and for so many years. And we definitely are seeing the differences in what is being more deficient. So I have not seen so many, I know I've noticed it in the last 3 to 4 years, so much B12 deficiency going on.
mhm,
That's a big one. Okay, it's always been, I feel, a D3 deficiency. That's out
right.
there. And I would
Always
say a
vitamin D.
big, good 90% plus of patients definitely have a D3 deficiency. What's really interesting that I've seen on lab work, we get lithium levels on patients too, and the lithium levels are extremely low. Like they're not even in a normal range anymore. And I think this would be an interesting study. But anyways, it's been over the last 5 years. No one has been in the normal lithium range, and we get that element from our water sources and things like this, but we're just not getting it. And so,
Wow.
anyways, when I start to see some shifts and changes of deficiencies, in the blood work, you start to think to yourself, okay, people are just definitely not getting everything from their nutritional outlets, which is their food intake, and then even some of their nutritional supplements that they take, right? Because they
Mhm.
have either a leaky gut or other problems going on. And so I think that, you have to think about, why IV therapy and why that type of nutritional avenue. And I think that, one of the reasons is to start replacing some of those things. Now we're kind of big proponents of, nutritional supplementing, and we do that on a regular basis. But on occasion, I'll find myself hooking myself up to an IV to go ahead and get a little power source, so to speak, and get a little
Mhm.
bit more, mega dosing maybe, especially if I'm feeling like I really need a little bit of an uplift, right? Or if I
Right.
have a little bit of brain fog setting in or something like that going on. These are really key important things, reasons for some of the IV nutrients. And
Wow.
one of the other reasons that we find is because we are so bombarded with all the outside, chemical,
Toxins.
yeah,
Yeah.
all the different toxins that are out there that we're exposed to on a regular basis, that this is just only going to help us, from that nutritional standpoint. And the nice thing is that, our supplements go into our oral, there's many
Mhm.
different routes of giving nutrition and or medications, and that's just one of them. But it also is kind of first pass, effect, and so it
Instead
has to
of
go
trying
through
to
the
rely on your
GI tract,
right,
right?
instead of trying to rely on your GI tract being A-okay, this goes right into the
Right
bloodstream.
into the bloodstream, and it allows for that increased absorption of those nutrients to the sources that it's needed, and
Mhm.
so that's what's so nice.
What
So
what are the different like infusions you might do?
right. There's various types, so it really depends on the need. And I was thinking about that. I was thinking, what goes into that as far as your thought process when you see a patient, who
Mhm.
would you think that would benefit from it? And I know as far as all the things that have taken place over the last few years with COVID, that was a time frame actually that we really did start to do the IV therapy, was because we saw the need, and we saw the long termers, or the problem with people having that brain fog that was lasting, the
Mm. Yeah.
cough that was
Mhm.
lasting, and that's actually happening right now again. We're seeing more
Mhm.
of the COVID patients still happening, still being exposed to, various upper respiratory infections, you name it. And so, anyways, people are actually taking, it seems, a little longer to go ahead and get through, in spite of even antibiotic therapy, for some. So, some of the things that we would provide, are different things for obviously different reasons. And so, we have to think about that when we're thinking about what type of IV would be the best for the patient. So, there's different, I'll just kind of name a few of them. There's one like a Rise and Shine. and that's for somebody who maybe they're overworked, maybe they had a big night out or a big party, or they just need a little refresh. A Rise and Shine IV would be good. There's one called Natural Defense. That would be the one for the person who is
Mm-hmm.
suffering from a cold or a flu or something like that and needs a little recharge. Fountain of Youth, this is something to go ahead and actually help them kind of do some regeneration. It helps with the DNA and things like this. Performance hydration is going to be one for like athletes, people who work out a lot, people who need some help prior to a big workout or a big performance,
Mm-hmm.
or a training. And then they get an IV after that type of an event, which would be a good one. And then the Liquid Lift is one that is for, goodness, so many people could use this one because it's kind of like a conglomeration of a lot of our nutrients all in one. And so just to give you a little idea of some of the nutrients that we do have out there that are in most of our IVs is the magnesium chloride, calcium gluconate, mostly all of your Bs. I'll just kind of put out there, a lot of ours have the what we call plenish or a B complex. And so it has like your B1, your B2, your B3, your B5, your B6, and your B12. So it's got quite a conglomeration of a lot of our Bs. And then we've got ascorbic acid, vitamin C, of
Mm-hmm.
course, and that is definitely a big immune booster. And I got to say that, where I do get my IVs, and I'm going to kind of hit on that because that's an important key point. And I want you to know the difference between what we do have at our office, possibly compared to some others, is
Uh-huh.
really important. But the vitamin
Yes.
C is mega dose. So there's 15 grams of IV vitamin
Wow.
C that you're getting. And so there's other factors and other things that you think about with each patient, who could get that, who shouldn't get that, right? What do we need to
Mm-hmm.
do to go ahead and actually make sure we're flushing our kidneys and things like this? And then some of the other ones are there's an amino multiplex, and that one has arginine, glutamine, lysine, and proline in it. And they're all for specifics, and I like to go over with the patient as they come in, what that does for them exactly so that they have an idea of why that's important for them. And then of course there's glutathione that we can give at the end of the IV treatment. We could either put it in the IV or we can give an IV glutamine push and our glutathione push, and that really does help give them a boost. And also, like I said, it's very important for the DNA. It's like one of the biggest antioxidants out there that
Yes.
we have.
Mm-hmm.
And so there's various IVs. And so just to give you a little background too, these IV nutrients are coming from a 503(c)(b) pharmacy. And these pharmacies are designated by the FDA. Okay. And they're actually, so there's 503A and 503B.
Mm-hmm.
503B is more so kind of like an extension for a office setting, right? And they're FDA approved. And
Okay.
I kind of have a little
Mm-hmm.
thing here that says that they have to comply strictly with the current good manufacturing practices guideline. So
So
they're
this
very,
the
very,
same guidelines as a
regulated.
pharmaceutical company.
Exactly.
Yeah.
Exactly. So
Mm-hmm.
that's where these nutrients are coming from, and that's very important. And the reason why, I'm going to just put it out there, I do charge a little bit more for my IVs than you might see because I did have a little idea of some of these local ones because they have some of these prices online. And I was looking, and I do probably charge a little bit more, maybe some Illinois type pricing. It's because I pay more. I pay
Mm-hmm.
more for my IVs, and I'm not buying multi-dose kits. I'm not buying these little vials that are actually used for several patients. That means
Oh,
more
more
injections.
contamination.
Yes, more
Mm-hmm.
contamination, and they have to have preservatives in them. Okay,
Mm-hmm.
my IVs don't have preservatives in them because
Ah,
they're
wow.
for that specific patient. And that's
Oh.
the difference between those are ours and then maybe some others, because others are trying to save money and they're trying to
Mm-hmm.
save a buck, and they do those things. And so when I went out to look for IV therapy and different nutrients, I wanted to make sure that I was getting the best for the
Right.
patient
So
and making
I don't
sure.
like to eat things that have preservatives in 'em, and I certainly
That's
don't
right.
want to inject it right into my
That's right.
arm.
And along with that,
Wow.
because we're seeing so much autoimmune and a lot of more sensitivities with our patients, when you're giving an IV, you want to cut down on the potential for a reaction in that IV
Right.
and problems and, things going on within your facility. So you actually don't want to, create more of a problem. Because you know what, when you think about preservatives, you may not have an issue that one particular time, but given the opportunity to go ahead and get several IVs over time, you can increase your ability to go ahead and have a problem,
Right.
down the
So
road.
how does somebody know? How does one of our listeners know, like, is IV nutrient therapy right for me?
Hmm.
And that's okay, let's stop with that. How does the regular person know if it's right for them?
Well, you know what? They can discuss that with their healthcare provider, right? They can discuss that with us and let us know that we usually know because we're looking at them as in the whole, as the person. We've known them usually over the years.
Mhm.
We've also seen their blood work over the years. And the way that we list our blood work is we trend it, we have it laid out in a whole
Right.
array of year to year, month to month, three
I
months,
can
6 months.
attest you do that. Yes. You look at the trends.
And so we're
So
able to see that. And so you could actually get an idea, if people are still finding themselves deficient, in
mhm.
certain nutrients, if they consistently are very low in their B12s and their vitamins that way, you can see the trend. I always know if somebody's not taking their vitamin D like they should, right? You see that
Yes.
right away.
Yes.
And what people don't realize is it takes so much longer with that being a fat soluble, right? Takes so
Mhm.
much longer to go ahead and build that back up rather than just maintaining it daily,
Mhm.
right? On that one.
Right.
The water soluble vitamins, like all these that we're giving,
The B's and the
are
C's.
usually
Mhm.
excreted right through the urine. 80 to 90% are excreted through the urine. And so you need these, right? We take them in usually on the daily. That's why we're eating our food on the daily too, right? We're trying to get these
Mhm.
nutrients in. And then our body goes ahead. You can't overdose on the bees because they're water soluble. Your body will use it and then it'll go ahead and excrete it. And that's why you have that nice bright yellow urine for the way that the body kind of gets rid of what it doesn't need. So you usually know based on the history, based on the lab values, based on, their symptoms of what they're complaining of. I can't tell you how many patients have so much chronic fatigue.
Yeah.
And the good thing about us, I feel, is that not only are we looking at so many things, but we specialize in hormone therapy. And as you know,
Mhm.
hormones have so much to do with our energy levels and our ability to go ahead and actually get through our busy, busy days and our stressful days. And
Mhm.
so knowing that we're also checking all the hormones, and I gotta put one out there. Sure, we check, your testosterone and your progesterone and your estrogen. We're also checking your DHEA. We depending on
That's
the
a
patient, we're
building
checking your
block of all the
cortisol,
others.
right? So
Mhm.
all of these hormones, are like the symphony playing in your body to go ahead and help you perform at your best. But if some of those are then off, there's ways of supplementing those types of things as well. And so kind of knowing the patient. So we
Mhm.
have had some patients that have heard that we do some IV therapy and they're coming in. And in fact, it's interesting because I had somebody come in, she was trying to get over a really bad cold. One of her relatives knew of us, was going to us as a patient, said, I know they give IVs, why don't you go to them? Well, I still go ahead and get a little bit of an intake and a history
Right.
before we're going ahead and actually doing the IV,
Sure.
just because we want to know. And it's interesting because that particular person, not only did we give her an IV, but then she came to see us as a patient afterwards. And then we were able to kind of go through and help her in
Yeah,
other
help the
areas.
whole person.
Yeah, yeah, which
Right.
is really important.
Right.
So I think you have to look at everything. And I just also, that was a good question. You just don't want to be giving IV therapy and nutrients to people that you also just don't know a bigger picture as well. Because
Right.
I at least ask for some basic labs, even if they're not going to do all of our labs. Some basic labs are important because I'd like to know what their kidney function is looking like. Because let's face it, if you're giving some, mega dose
Mm.
vitamin C, a lot of that is also, we need to know how that kidney function is
It's got to
going. If
flush the
there's
excess
if there's
out.
a kidney patient, I'm gonna reduce the amount of ascorbic acid that I'm gonna give them too. So you have to kind of put all of these things in perspective and kind of get an
Hmm.
idea of what would be the best for that particular patient, so that you're not overdoing it, and that you are doing it safely. So I think that's
So
important.
when you assess somebody, whether they're a current patient or one of your ongoing patients, and say, you know what, we really need to do some nutrient infusions. Is it a one and done? Is it a series?
Yeah.
How do you determine that?
That's a good question. Actually, we do the one, and then based on their health, based on their history, based on what they've been exposed to, what is it that we're treating? Was it a toxic exposure? Was it a bad virus? Are they faced with a lot of autoimmune, maybe multiple, right?
Hmm.
Or are they having also now sensitivities, developing?
Hmm. Hmm.
So I think that goes into play when you're thinking about redoing another IV for them. So when you are dealing with maybe athletes or performers who are working up to certain things, you might do two a week for them, right? They may be doing a little bit more often before and after their meets or their performances. Um, but somebody who is like the other person who I'm talking about, that maybe have something long term, maybe a Lyme's patient or something like this, probably monthly for a few
Oh,
months might get them
okay.
going. And
Right.
then maybe 3 months or 6 months
Oh,
or
okay.
maybe biannually, just to go ahead and actually. And you know what? A lot of times the patient themselves know when they're starting to feel really run down, and they're feeling like, wow, I know how good I felt when I took that.
Right.
Maybe it's time. So I think it's really important for the patient, just like I'm sure you always practice this, to really listen to their body, because their body usually tells them, when
Hmm.
it's time for something. It's just
Yep.
like the hormone pellets, or the hormone replacement. Patients usually know when it's time to
Right.
go ahead and come back for something like that. So I think that
So
that
true.
really helps. And I
Hmm.
think you, just like you see, Nancy, I think patients are more and more up on a lot more
Oh,
things
it's
that are
amazing.
available to them and
Right.
what's happening with their body. And I
Hmm.
think that you've seen them also go from doctor to doctor to doctor and not get the answers that they're looking for. And
Absolutely.
so they're still hearing their bodies saying, I need some help,
Yes.
so they're much more in tune, I think, with what's going on with them. So it varies.
Hmm.
It varies, to answer your question, but I think people are really pretty good at kind of knowing when they're starting to
Yeah.
feel
It's
like they
so
need something.
amazing to me the questions I get lately, like, Dr. Nancy, have you heard of grounding mats? And I'm like,
Yeah.
yes. Dr. Nancy, I'm going to buy a laser, but I don't want to buy like a laser like yours because it's too expensive. I would just want a red light for have at home. I'm like, oh my gosh, that's awesome. It's like wonderful. Like
It
people are
is
all of a sudden
awesome.
like the light
Yeah.
bulbs going on.
It's so
So,
great.
so when somebody comes in for an IV infusion, a nutrient infusion, how long does that take?
Yeah, that's a good question. Typically, it's anywhere from 45 minutes to an hour, hour and a half. It
So
really
bring a book.
depends. So bring a book, if you even need a snack. The biggest thing that I really
Mm.
ask them to bring is water. Because a lot of people drink water out of their own containers, usually, hopefully, non-plastic, right? Of
Mhm.
course, in the office, I do have water bottles, but I also have a water filter, and I do have cups. So, like those solo cups. So that's a little better for them, so that, because we're trying to get away from plastics, right?
Yes, so bring your own water
So
bottle.
bring your own water bottle source. You
Right.
can always refill in our nice,
Mhm.
filtered container there that we have. Bring a book, yes, and and the reason why I say it kind of varies for the patient, it depends on their veins sometimes because it depends on the size of catheter I might have to go ahead and put in.
So
If I'm using a
smaller
smaller
versus
one,
larger.
it might take a little longer. If
Got
I'm
you.
using a regular size catheter, then usually about an hour is pretty typical, maybe at the most an hour and a half. So,
Mhm.
and you know what? It depends on them too. I can go a little quicker on the IV as long as they feel comfortable with it. Sometimes vitamin C on occasion can feel a little bit stingy,
Yeah, I would imagine.
and
Mhm.
especially if it's going a little too fast. So you just kind of gauge it to the patient themselves. And
Mhm.
so then that's why it varies a little bit, based on the catheter size. The other reason why I say bring your water and make sure you're hydrated before you come is because I can find a vein much easier when you're hydrated, right?
Mhm.
Makes a lot of sense. And, that does help me go ahead and actually. And then as far as, the person who's going to start the IV is usually the licensed person. It's going to be the RN, it'll be the
Right.
NP, or it'll be the MD or the DO, right? So
Right.
it won't just be a medical tech, or it won't be somebody that's just available at the office. It'll always be a licensed practitioner who will always start the IV and also manage the IV and make sure that it's not infiltrating, make sure that, they're doing okay, watching for any reactions or signs of that. So,
Mhm.
not just starting the IV and, forgetting
Walking
about them, and
away.
right. Yeah. Just making
Mhm.
sure that you're managing them and maintaining, and make sure they're comfortable and those kind of things. So, I think that that all goes into play. And I know that a lot of these other facilities that, this is all they do, right? That's what the facility is for. They're making them more apt towards like almost spa like. So they may have those, massage chairs and the different types of, things and TVs. I do have a TV I'm ready to mount so that I can have it in that IV room, and things like that. So it'll be a little bit easier for them. But most people bring, a book, they bring their water, and they have their phone. So
Mhm.
usually it's for an hour. It's comfortable enough for them to go ahead and get their nutrients and
Mhm.
be out the door. So,
Can you
um,
tell us, without giving away obviously any health information about a person, can you tell us a story of a specific patient and how they, what their experience was before and after nutrient
Y-
therapy?
Yes, I just had one recently, actually. It was a good friend of ours who is our patient, and he was sick. He had just been out of town. He probably got something away. He had a cough. He had an infection. He was already being treated, but this was just lasting. I know you've heard this cough has been lasting people for a couple of months, believe it or not.
Mhm.
But anyways, he had an infection, and then he came, and I could just tell by looking at him he could definitely use an IV lift. And so I got him on started on the IV, and I actually gave him that liquid lift that kind of threw everything at him. In fact, I saw it in the fridge, and I thought, oh good, I think this, the amino lift will be great for him. And sure enough, what was so funny? Yeah, he got the IV. The next day, he texted me and said, "What did you put in that IV?"
Wow.
And I said, he said, "I not only had the most vivid, clear dreams, but I feel like I am on top of my game today with everything like in order. I am like so ready to face the day." And I'm like thinking, wow, I feel like I got a little brain, transplant here. But he said it was just an amazing uplift from a focus standpoint. And I think that that's what those aminos will help you do. That arginine is very important for focus and, brain focus and things like that. So that was really a neat testimonial to the value of what he needed at the time, plus also, the value of him also getting this mega dose vitamin C, because he said, wow, within 24 hours, he says, I've got to tell you, I feel like almost 100% better. He goes, my
Wow.
cough is better. I just feel so much more uplifted and just have so much
Wow.
more energy. So, and then he said, and how often can I get that?
So that's a great question.
So I told him, I said, why don't you wait 1 week and then let's get you right back in here and get another
Hmm.
another dose of that, because it really did make a difference for him. And he is a person that is out there in the public quite often, and he does have to be on top of his game. And so I think that that would be a real benefit for him for sure, especially trying to get through a bad cold that was
Right.
lasting. So.
Wow. I'm gonna
Mhm.
have to try this the next
That
time
was
I
a
come
that was a
by.
really nice testimonial to
Uh-huh.
a nutrient that should do just that,
Yeah, okay, good. And it did. It performed
and it
as
did,
expected.
and it did.
Very
It was awesome.
cool.
Yeah.
Very
So
cool. Yeah, I think that's what I'll do. I'll probably call your office next week and get on your books because I'll be in your office in a few weeks for my pellet. It'll be about
okay, good,
6 weeks. And is it
good.
okay to do those both on the same day?
You could.
Good.
Yeah,
Okay.
yeah.
All
Why
right.
not? There's no
Okay.
reason why not.
Okay, good. Okay, good. So as I'm hearing this, it sounds like it's something you can do for general wellness to perform better, feel better, be a better, be a better person or better wife, better husband, better mom, better dad, better at your job. But also it is for if you're struggling with something and your body needs that help. It's also for
Yes,
that too, whether it's a major illness or a cold or a cough that won't go away.
right,
So, but also I'm hearing that it's not just something to do on a whim when you don't have a professional that is looking at the whole person to know
right,
what's right for you.
right,
So,
right. Yeah, I
and
think that's
and
important when you're thinking about your health, and just making sure that you're going to somebody who will look at the whole person too, and just kind of keep these things in mind. Like I said about your kidney function, what's your overall health? How long have you been, dealing with this kind of situation? And so, yeah, these are great nutrients, and they do help. But as a medical professional, you also have to be thinking about all the other things that tie
oh,
into that, of
absolutely.
course. I want to give you one other little example of a amazing testimonial to these IVs. One was another dear friend of ours, also patient for many, many years, but um, wound up developing breast cancer. Okay, and some people do wonder, does this help with people who have had cancers? And I say yes, especially vitamin C. You can look in
Mhm.
PubMed and see all the literature
Mhm.
on vitamin C and how it tries to fight off cancers, right? And so, anyways, this patient, I think we've done it several patients with cancer, but it's really nice to do in between IV therapy and nutrients, because the chemotherapy obviously is so hard on the body, and how patients who have undergone chemotherapy, how they feel
Oh,
and how low they feel, not only mentally but also physically, and their bodies are so depleted of some things, that in between chemotherapies, if they're every other week, it's nice in between to go ahead and get some vitamin C nutrients to go ahead and actually help give them
yes.
that boost of energy and help counteract some of the things that the chemotherapy is also. Don't forget, it's also destroying good cells.
Good cells.
And so we
Right.
need, some glutathione and some vitamin C to go ahead
Mhm.
and actually counterbalance that. And they feel amazing in between. And so when they're feeling their lowest, this can kind of help them get back up
Oh,
and go
wow.
ahead and give them the energy that they need. But she was so amazed that she got this steadily during her very, very taxing chemotherapy treatments, and she got the gamut, right? But she did amazingly well. And
Wow.
she swears by the IV therapy that was the reason why she got through her chemotherapy. And the people at the chemo, when they would give it to her, were thinking, why are your numbers so good? Why do you feel as
Wow.
good? Why are you not having the nausea and the different things that so many patients undergo? And she just was such a positive attestment to the fact that it was because she was getting IV treatments in between her chemotherapy treatments.
Wow.
And
So, yes.
so, and in that, also stating that I don't give the B vitamins with people who are undergoing the chemotherapy because I have heard that the Bs can negate the chemotherapy. So I'm
Hmm.
kind of careful about that, and I wind up just giving. Usually, I can count on the vitamin C megadose plus the glutathione to really kind of get them through some of that. And then some of those post chemotherapy patients, it's fantastic to go ahead and give
Oh,
them, like I
yeah.
said, some of these aminos because now they're dealing with some of that chemo brain fog and things like that. And they, over time, you start to see them, increase,
Oh,
their mental capacities because they've really gotten what they need.
what a
And so,
blessing.
yeah, it makes such
Wow.
a difference for them. I can't tell you. It's been great.
Everyone listening to this, if you know somebody that's going through that, please send them to Julie Streeter or somebody that does these IV infusions for nutrients that is a medical professional so that they can be monitored. Oh my gosh. What I mean, it's one thing to say, hey, I feel a little brain foggy, maybe I need infusion, but it's another whole thing to say, I am in this life, this life
Right.
altering event. Like, how can I help my body heal? That's
Right,
huge. That's
right. And
huge.
I've heard from patients too who have actually had, like, say, for instance, Lyme's disease, and they were getting glutathione IV pushes, like almost on a weekly and then monthly as they were
Hmm.
going through this new disease process just to try and get them through. So I know glutathione is also another great antioxidant when
Hmm.
you're dealing with such a long-term type of
Right.
a illness. So
Right.
so that's
Wow.
another thought.
So much
Um,
good. So much
mm,
good.
so
So as we wrap up here, Julie, this is kind of be off topic a little bit, but if if you could tell our audience just one thing they could start doing today that would aid in them being healthier, what would it be?
one thing, okay. One thing I would say is go get checked out. Go
Yes.
get checked out
That's
because what
right.
here's what happens. So many people don't get checked out. They're dealing with so many things, but they just really because you know what? Numbers so often do coincide with how they feel, and I see it day in, Nancy, and day out. And it's so interesting because when we do get the blood work that we do, which I must say is a little different than
It
traditional blood
is.
work,
It is.
when I see why they feel the way they do, and it's all right there as we go through it, then they're
Right.
saying, "Oh, thank goodness, now
You
I
found
know
something.
there's a reason why I feel the way I do." So the one thing is to get properly checked out
I
and get
love
the
it.
information that usually almost always coincides with how they really feel.
Yes.
So it doesn't lie.
Exactly. It's the same in my profession. Like people say, "Oh, I don't need a chiropractor. My neck doesn't hurt." And I'm like, "I bet you probably do. Chances are,
And the minute you put
75% of
your
the pop."
hands on them, you
Yes,
know,
I
right?
know.
It's
You
yeah.
actually
So
need some adjustments. So yes, get checked out. That is brilliant and profound. Thank you so much. Well, it's been awesome.
thank
Thanks for all
you.
the info. Thanks for teaching me about this. And now I will
Oh,
be able to
thank you.
explain it to my people at my office.
Thanks so much,
So,
Nancy.
as always, for our audience, thank you so much for being here with your Healthcare Arsenal podcast. And as with each passing episode, my hope for you is that you get closer to being your own best expert. Bye for now.